Some small businesses don't have stores.
All right, George, go.
We want to welcome everybody on tonight. Welcome, welcome, welcome to the Source Seeker Hour. I am back. I've been gone for a while, but now I am back. Proud to be on the Source Seeker Hour with some very great guests. We want to give a shout out to the Source Seeker himself, Mr. Baruta Carl Alexander, the man of wisdom, the man of knowledge. We want to give much respect and honor to you, sir, Brother Baruti. On today, I got some great guests, and the topic is a topic that you heard us go at before, but we're going to take it to the next level on tonight. COVID conspiracy theories. What's really going on? And the guests that I have on here tonight to discuss this are very well read, and they're going to give us a lot of information on tonight. We have Miss Karen Coney that's with us today. We have Nurse Cassandra Barnes. We have Dr. Vion McReynolds. And we have, once again, we're happy to have him back, Dr. O'Dilley. Oh, we got a great show on tonight. Before I get started, Lady Coney, I know, what am I missing? I like calling you Lady Coney, but what is the proper title I should be calling you?
You can just continue to call me Karen or Lady Coney, however you want to do it. It's fine with me.
Okay. I know you got a wealth of knowledge. I just didn't know what actually to call you, but I'm going to start off with you. If you could real quick tell us about who you are and what you do.
Okay, I'm Karen Coney, and I went to school with Baruti. At the time, we called him Carl Alexander. And I have my major was biology, although I didn't complete it, but my major was biology. And I have years of X-ray tech and medical assistant. And I have my own business where I tutor children, as well as adults, getting them prepared for testing or the SAT or the GED. And I also work with special needs children. And I really do a lot. You know, I fell ill back in 2014, and I had to stop working. So I've started my own little businesses. I do various things here and there, you know, and I have 17-year-old twins that are at home. So they'll be gone next August. One just got accepted at a very high college I can't mention yet because we're sworn to secrecy until November. But I am excited about that. And next time we meet, well, when we meet in November, I'll be able to tell you guys. But I just love life. And my major, like I said, is biology, and I have never stopped studying it.
Oh, wow. Hen, are we talking Ivy League college, huh?
Very. Y'all are going to be amazed.
Are we talking Brown, MIT?
Okay. They told us we cannot say anything on social media.
Right. I'm being messy. I'm just stirring up the tea a little bit. You got to pray for me on that.
That's all right.
We are so glad to have you on the show. I also have Nurse Cassandra Barnes on here. Nurse Barnes, tell us something about yourself.
Well, hi, my name is Cassandra Barnes. I am a registered nurse for 32 plus years now. I hold a master's in psychotherapy or professional counseling as well. I have a lot of various certifications in many aspects of healthcare management and have been highly, highly celebrated across my career from many different agencies. So God has blessed me tremendously. And so I'm just real pleased to be here again tonight. This is an amazing discussion, and I am looking forward to it.
All right. Happy to have you on here, and it's going to be hot. Speaking of hot, Dr. V is in the house. Dr. Vion McReynolds, the voice
Yes,
of reason. Talk to us, Dr. V.
I would like to be the voice of reason. I do have a PhD in psychology from University of Texas, community psychology. So I'm interested mostly in the mental health of particularly the Black community. I have a nonprofit that I run called Pt2, which has 3 components. We do bicycle repair, trying to get people out especially during this time of COVID, that, you know, if you go to the bicycle stores, they're all sold out. And we're doing the repairs and helping people put those bikes together. We also have a project called Third Ward Tours where we're actually getting people out and they're still riding with social distance so they can get out and get some exercise. Trinity Hood, we've suspended that until the sports teams have 50% of people in the stands. We're, as they say, we're going to err on extreme caution, you know, so that's what. But conspiracy, that is one of the things, particularly psychologically, that confuses people, and we don't need confusion at this time.
All right. I've been getting fat during this quarantine and social distancing thing, but I haven't distanced myself from the plate. So I may have to come by your shop and buy a bike.
Okay,
and,
great.
and get myself together. Oh, thank you. I know we're gonna have fun tonight. And last but not least, we've got we've got Dr. O'Dilly here with us on today. Dr. O'Dilly, glad to have you. Could you tell us something about yourself?
Good evening, everybody. Thank you for having me back. It was a pleasure last time, and I look forward to engaging in the discussion again this time around. I am a board-certified family medicine physician. I own and operate with a business partner, Apex Urgent Care Clinic. We have 2 locations in Houston, and I do freelance emergency medicine as well. So we've been taking care of emergency patients and COVID-19 for the past 6 months. So look forward to sharing some firsthand knowledge with you guys tonight.
Oh, right. Well, Dr. O'Dilly, we're happy to have you on the show. And you know, in the word we say that the first shall be last and the last shall be first. So I think I'm gonna start with you to break ice on COVID conspiracy theories. And I think the first question that I want to ask, and we might have touched on this the last time we talked, and then everybody else will get a chance to chime in. And one of the questions that I've come across talking to people, people are saying that if this is really a virus, then why are so many doctors today treating it with antibiotics? Shouldn't they be treating it with an antiviral, or could you shed light on that and help those of us that are not experts in the medical community?
So the vast majority of patients who are diagnosed with COVID-19 are not receiving prescriptions for either antibiotics or antivirals. Now, there was some thought initially that patients would be getting better with azithromycin. The evidence only bears out that antibiotics are useful in treating patients who have developed pneumonia. Once a person has developed pneumonia with COVID-19, it is not easily possible to determine if they have a bacterial superinfection. So they can have a viral infection with the COVID-19 virus and have a bacterial infection that's causing the pneumonia to worsen. That can happen simultaneously. So once we see pneumonia on the chest x-ray or a CAT scan, we are going to, in a preventive fashion, prescribe antibiotics. Not because we feel the antibiotics are going to kill the virus, but because the patient has pneumonia and we cannot prove that they don't have bacterial pneumonia in addition to the viral pneumonia. So we're treating the part that we're able to treat. We prescribe steroids for COVID-19 when patients have respiratory distress, because the anti-inflammatory effect of the steroids has been proven effective in helping reduce the burden of symptoms in these patients. So we feel like the antibiotics are for bacterial pneumonia and the steroids are treating the COVID-19.
Okay. Well, Dr. O'Dilly, I'm not going to put you on the cross, and I'm not going to put you in a situation where you would have to say anything negative about your brothers and sisters in the medical profession. So I'm gonna say it in a dogmatic way. What's going on with the maverick doctors that are doing otherwise than what you just prescribed?
So medicine is an art. It's a practice. It's something that evolves over time, and something that each provider, each practitioner has some discretion in how they want to practice medicine. We are in a country where you have some liberty in terms of using things off label. So you are going to find some providers that are more liberal, and they're taking steps in different directions to prescribe things that you might not get at another place of practice. You're allowed to research on your own, read, etc., and prescribe what you feel is best, as long as you are not being reckless or intentionally or willfully reckless or dangerous. Then it's something that you have a lot of flexibility in terms of what you want to prescribe and how you want to treat a problem. So until the government or some board says that something is illegal or you cannot use it, a physician can still use it. Even if it's recommended against, a physician can still prescribe it. The pharmacy can still fill it, because that's how the law is set up. So it does sort of fall on the consumer, the user, the patient, to have a good relationship with the person they're seeing, to know that they have trust in the provider, so that they can feel comfortable taking what's recommended. Because you might be taking something off label or against recommendations. The provider should let you know that ahead of time, but we know that doesn't always happen either. So really, it's something that everyone should just, it's okay to get a second opinion. It's okay to do your own research. You may just want to double check what you're getting if you have any reservations whatsoever.
So this isn't like, and I was just spending a little time with you before I bring everybody else in, because you are the quote unquote medical professional on this panel. You're one of them, but you're the MD. So is the reason that COVID is a disease that we're still learning about it. So do you feel this is a reason why many people are liberal? Because I mean, like, if I came into your office and I had BD, you wouldn't prescribe me vitamin C and zinc and aspirin. You would already have a medical protocol of some tested antibiotic you would give me. But venereal diseases, including HIV, have been with us for a long time now. So because this is a new virus, would you feel that's maybe one of the underlying reasons that people are kind of treating it the way they feel best?
Exactly. Because we don't have years and decades of experience treating this virus, there's not a panel or committee or group of scientists that have come together and given formal recommendations on the best way to treat this. We don't have what's called best standard practices. So because the virus is new, and I think that everyone is acting in the effort of trying to save lives, you are going to see a wide variety of different approaches.
Okay. So hydrochloroquine, I hope I'm saying it right, with a Z-Pack is not the end all be all, for quote unquote.
No, in terms of widespread studies in the hospital and outside of the hospital, there's not been any strong evidence to suggest that statistically it's going to make a big difference or treat a larger number of patients than the patients who receive something different or nothing at all.
Okay. Wow. I know I got to bring everybody else in, but I have to say this. We have yet to see our president wearing a mask. What is he taking?
It's hard to say. The primary method of prevention for the president, and I do touch upon this in the book I wrote, everyone in the White House gets a COVID test every day. So as long as everyone else around you is getting tested every day, personally, your risk is a lot lower. For everyone else who comes in contact with strangers, casual contact, friends and neighbors who don't get tested on a daily basis, we have what's called a baseline risk. So we just have a regular average risk of coming into contact with someone. So we should all wear masks because we don't know where the person next to us has been. We don't know where the person sitting behind us or standing behind us in line has been. We don't know who's touched a shopping cart ahead of us. We don't know who's touched a doorknob ahead of us, etc. All these things we cannot account for because we live in the real world. When you live in a closed environment like the White House and you can afford to have everyone in the White House tested every day or every other day, that's a whole different ball game. So you don't necessarily need to take any special medicine to protect yourself if you're testing everybody else around you and you know that they all don't have the virus.
Okay. Thank you, Dr. O'Daly. Now, I got big respect for you, so I'm not going to hit you with this question, but provided the information that you've already given us, I want to go to Karen Coney, and I want to see how she feels about this, because concerning what you just said, I don't know how many people saw it. There was a video that leaked on social media that had one of the White House staff, while they were getting a room ready for a conference, and they were distancing the chairs for the news media to come in. Somebody said something to the effect like, I don't know why we're doing all the work. You know, the president and all of them have already been vaccinated. I don't know if anybody in here heard about that media leak or if you actually watched the video, but there is a conspiracy stating that the president and his closest staff and advisors have already been inoculated for the COVID-19 virus. Karen Coney, is this a conspiracy? Is there some truth to this? What's your take on what's going on?
Well, I haven't heard the video, but I heard about it. And you know, in our last meeting when it kind of got really, really heated, you know, I knew, at least I feel, I'm not in the medical field, but I study a lot of biology. And you know, with you common sense, you can put 2 and 2 together. When you see them up there touching the same mic, the same podium, no mask, you know, not experiencing 6-foot distancing, but yet they're telling the community why? Because they've been protected. I really believe that. You know, of course, none of us have proof, but I just feel like it doesn't take a rocket scientist to look at the evidence, you know, that there's something different with them. And yet they know that the community has not been protected yet. So it's their duty to, of course, tell us, you know, how to practice 6-foot distancing. But I used to be an Uber driver. I'm no longer an Uber driver, but I was driving for Uber one day, and I had a medical student who was in the car. I think it was in February, right after right after, you know, they started talking about the COVID-19. And so I was kind of questioning him and asking him, you know, hey, what are your professors are saying? What are they talking about in med school, this and that? He said, Miss Karen, they really keep things really hush-hush. Even though I go to med school, he says, if you see something that's not out of the ordinary and you ask about it, they just skip over it, because whatever the professor says, whatever the scientist says that are ahead of you is what is golden, you know, and you're not allowed to, as a medical student, you're not allowed to speak out against it. He says, but I know that there are some things that are not actual what they tell us, but we're not allowed to speak out against it. And that really bothered me, because, you know, we have a sense within us that God gave us if something is not right. But if a student, because he's new and he goes in and Dr. O'Daly, I would really like for you to ask you that if that was the same when you were in med school. But he was saying that if he sees something out of the ordinary and he asks the professor, that, you know, he's considered being subordinate or something like that, he was saying. And, you know, I honestly believe that there's a real deep conspiracy involved. And another reason I believe, I cannot tell my source, is for someone who works for the government that I'm very, very close to. They contacted me back in February or March, whenever this first came out, and say, Karen, this is real. Is something coming? It's going to be really bad. And you need to protect your family, yourself. And sure enough, I'm telling you, in less than 14 days, it was, COVID was just like rampant all over the place. And thank God I was given a notice, before it happened, because they work for the government.
Did they tell you this? I'm just asking a quick question and you can continue. Did they tell you this before it hit China or before it hit the United States?
Before it hit the United States.
Okay.
And they work for the government.
Okay.
They are a really big wig in the government. They knew. They had been advised. They had been told about it, but they were told that they could not leak it only to their family members. They could only tell. That's why, I thank God that I know someone who works in the government. They were only allowed to tell us, and we were not allowed to say anything.
Wow.
We knew it was going to happen.
What month was this?
It was February or March. It was before it hit the United States. It was before the first person was diagnosed with it when they told me about it. And it happened. Wow.
Well, Dr. O'Dilly, she did ask you a question, and I think it was is that in medical school, all the medical students, and I'm sure we all know the answer to this because of the nature of it, but as a medical student, it's not. Would you say it's not a prudent thing to challenge the professor with an opposing or a new idea to something that's being treated? Would you say?
Honestly, I never had an experience where we were being silenced or ignored. Our professors were pretty open in terms of their discussions. Now, we weren't dealing with any political issues or a pandemic like we're dealing with now. So I think that the current circumstances are different. But no, I never felt a situation where if anyone suggested an alternative treatment method or questioned the literature or research behind it, that we were ignored or shut down. I feel like the evidence always took precedent. Whenever anyone made a recommendation in terms of what treatment should be, evidence had to stand behind it. Some research protocol or something that showed that there was efficacy always had to stand behind it. Now, I went to medical school at the University of Texas of Houston here in the medical center. It's a very research heavy, institution. So I feel like it's just part of the program that we practice evidence-based medicine.
Oh, wow. That's really good. Very good. I got to bring Nurse Barnes into this, and she got to give us her take on all this, what's going on, from the antibiotic treatments to the hydrochloroquine, to does the president know about a vaccine and he's not telling anybody? And I must say this, and I'm not being messy, it makes me wonder, and what makes me wonder has nothing to do with COVID-19. I was, I'm not trying to tell my age, but I'm very close to 50 now. I was in my early 20s when an athlete by the name of Irvin Magic Johnson made, I might have been 21, 22, I don't know, but an athlete by the name of Irvin Magic Johnson made an announcement that he had HIV. And at that time in the early 90s, everybody that had HIV pretty much had a 2 month to a year time limit. If they said they had HIV in 6 months or less, we heard about them dying. Irvin Magic Johnson looked younger than me. He's healthier than me. What happened to him that didn't happen to everybody else that got HIV? And I know a lot of people that got HIV after him. I'm talking about the year 2000, and they're dead now. And this man looks better than some people that are in the NBA right now. what medicine was he on? So it kind of makes me wonder, is there a medicine that the president is taking for COVID that nobody else, because I'm in my mind, Nurse Bourne, Magic Johnson had to take something that somebody else was, that nobody else knew about, or either he didn't have the disease at all. It was a hoax. So Nurse Bourne, I just said that to stir up the tea, but give me your take on everything. I'm
Okay.
sorry.
No, you're good. You're good. Okay, so it's several dynamics. He actually was what we consider HIV positive. That means, because I know people that actually, when we look back, that actually was not diagnosed, but had what we now know as AIDS back in the 70s, and they are literally still living. Okay, before
Wow.
we had medications. The difference with Magic was that he was very physically fit. Okay, so he was HIV positive, but he did not have what we consider full-blown AIDS. Okay, so you're carrying a virus, you can transmit the virus, but you don't have the actual disease process, which is why if you remember, initially he continued to try to play until he got cut in the game, the Olympic game, remember? And everybody got scared because he was bleeding, right?
Right.
Okay, so I'm probably a little bit older than you. I'm 57. I was literally just coming out of nursing school. I graduated in the late 80s, and I worked HIV/AIDS for about 3 years early on. So he had what we consider HIV positive. He was actually positive. And back then, of course, we didn't know a lot, but they had a lot of medications that were in test form, okay? So if medicines are in test form, they're not approved by the FDA, okay? But when you have Magic's money, you can afford to buy these medications. Now, I'll give you an example of test medication. I have a disease process that's called polycystic kidney disease, where I have my kidneys have huge cysts. I just got the report today. One cyst is almost 15 centimeters. Another cyst is 13 centimeters on the right side of my kidneys. I have cysts on the left side that are 8 centimeters. The largest ones are 8 centimeters. Okay, so there's no known cure for that, right? But there is a test medication. It's a type of chemo that is $10,000 a month that would cost me to take that medication. Of course, I would not be able to afford to pay for that. However, if it was Magic, Magic could afford to pay for that, okay? So there were medications that he had access to that allowed his, what we call his T-cell count. That's why, remember when they were all saying he had been cured from HIV? He actually, I would challenge the fact, and I don't know for sure because I'm not associated with him medically, but I would challenge the fact that he has not been cured. What happened was those medications brought his T-cell level count below where it would be detectable. That does not mean you're cured. That just means we can't pick the virus up in a test. But if you stop taking the medication, it's gonna bounce right back. So what he probably had, because a lot of people were saying that early on about Magic having access to medications that other people didn't have access to, which was true because he could afford to pay for medications that were not yet approved by the FDA that we have now. Look now, I mean, very few people, I'm not gonna say very few people because HIV in full-blown AIDS is still a terminal disease process. But I literally have a patient that is 80 82 years old. She may be 83. She's not my patient currently, but she was earlier this year. She is 82, contracted AIDS when she was in her early 50s. So she's already lived 30 years, which is dealing with that timeline that you were talking about. And back then, what we saw was Black males in particular that died really, really quick early on. But that's kind of the dynamic. But now anybody has access. This is why you can't hardly tell anymore. They don't look sick like they used to. They're living decades. You know, they're living their lives. As long as we can keep that T-cell count low, undetectable, they can live as long as you and I can if their body is healthy. Now, where it jumps off is if they get sick. You know, if their body is compromised some type of way, then you have another dynamic, you know, where it may jump off. But as long as they're healthy, like Magic is, he's gonna have the highest levels of nutrition and be physically fit. That HIV, as long as it's undetectable, they're actually saying now that it's not even transmittable if it's in the undetectable state. And then now you have other meds like the PrEP and all of these other meds that have come out. So that's what he had access to early on. Now we're going to deal with what she's saying. I agree and I understand what Dr. O'Dilly is saying about everybody in the White House being tested pretty much every day. But we already know, as narcissistic as President Trump is, how many of us really believe? I had that COVID test. Oh my God, I'm like, I don't ever want to, and it don't hurt, but it makes you feel, you know, when you're in a swimming pool and water gets in your nose, that's what it feels like. And I hate that. I can't see Donald Trump, as narcissistic as he is, going through that every day. I can't see him going through that every other day or even once a week. I really just can't.
It's too invasive.
He's too narcissistic and too arrogant. He's not gonna have you sticking that thing up his nose every day. That's just, I would have to literally see that happen to believe that. I don't believe that. And even if you are being tested every day, you can transmit the virus asymptomatic. You can all of these people are going home, coming back, whatever the case may be, then now you're still at risk. I don't care if you are being tested every day or every other day. None of them are in isolation. So they're all interacting with the external world. This virus we know is airborne. So to walk around, I don't care who's being tested or how often, he is too narcissistic and too arrogant to be in close proximity to people that don't have on masks that are interacting with the public every day. I just don't believe that that's what it is. I did hear the recording when Vice President Pence said, we have already been vaccinated. I heard the recording, it was his voice. He said that. Now, I do believe the thing that's crazy to me is vaccines normally take several years to develop a vaccine. Even when we have the antibody, you know, you're getting the antigens or the antibodies from people that have been diagnosed with COVID and all of that. You're not going to have a vaccine in 6 months, 8 months, a year and a half. I don't buy any of that. When they're saying that they may have a vaccine in November, if you have a vaccine, you were working on this vaccine way before now. Okay, that's number one.
That's right.
You didn't start working on it in February or March, and you have a developed vaccine in 6 months. It just does not work like epidemiology does not work like that. Then you have a mutated virus, okay? So you have to go through. This is why we don't have a vaccine for the common cold, because you have over 100 or so different strains of the common cold. You have a mutated virus that we don't even have true experts in, as Dr. O'Dilly stated, because it's too new. We all deal with evidence-based medicine. You don't have enough of a timeline, first of all. And now you have a vaccine developed when you have full disease processes that have billions of dollars worth of research, and they can't develop a vaccine yet. That actually, there's not a vaccine for HIV/AIDS or a lot of other viruses.
As far as understanding,
but you can come up with 1 in 6 months for something that's mutated that we don't even understand yet. So no, I don't believe it. Either they've been working on it for the past 5 years and we don't know nothing about it, or
Hold on 1 second. Brother Baruti, I don't know if you can hear us, but I think your
right
mic
here,
is
brother.
unmuted. Okay.
Yeah.
I'm right here.
Yeah, your mic was unmuted. We could hear your conversation.
Oh, I'm okay. Yeah, I'm sorry. I planned on coming back in right now.
Oh.
Okay. Just mute the mic for us. So anyway, that is, I don't care how often Donald Trump is too narcissistic. He ain't getting tested because I wouldn't be able to even deal with that every day. That's just nothing. But so no, I don't believe it.
I want to stop you a second, Nurse Bourne. I want you to quickly answer a question for me, and I want Dr. McReynolds to come in, and then we'll go back to Dr. O'Dilly and Karen, because I want everybody to get on this. I'm going to stir up the tea a little bit. You made a statement that I caught, Lady Cassandra Barnes, when you were talking about the HIV, and you said that when it looked like everybody was dropping like flies, what was really dropping was, you said, young black men. Now, I caught that when you said that. So the question that I want to ask you now, was there any truth that you think that this was a disease that was intentionally created in a lab to take out certain groups of people? Because I've heard medical experts say on CNN, I heard them say it on Nightline, and whether they were quacks, I don't know. Dr. O'Dilly can help us out with that and tell us what's really going on. But I heard that they said that this disease specifically attacked the lungs and I guess the respiratory cells. Somebody can help me, bronchial passages and all of that, of Asian men, and then second after that were men of color, preferably black. But I heard that it took out the Asian. It was a disease that was very prevalent to take out the respiratory systems of Asian men and then men of color. Do you think that is that a conspiracy, or do you think there should be some truth to that? Answer that for me real quick, and then I'm gonna go to Dr. Vion and let him chime in.
The reason why I actually don't think that part is because there's no way for you to control that aspect of it. That's why I won't do the vaccine, because to me, if you're injecting somebody with something, you may be able to control it, but them just breathing and contracting a disease, I don't think you can designate that per se. But the reason why we are more susceptible is because overall our health is more compromised than other races, just based on the way that we eat, the way that we are conditioned as a result of slavery. Our DNA is very different as opposed to how our ancestors ate and what's coming down through the DNA. There's a lot of things that are more physiologically that makes us more susceptible to certain things, just like HIV/AIDS when we had more the black men dying so quickly. I can't understand exactly, but we had a lot of white guys. I mean, white people and black men were dying very quickly early on from that. But I don't think you can designate it like that because it's just a draw, you know. But this is why we have to be more in tune with our health, the way that we're eating as a culture and as a race of people, and our general physiological state, I think is really what is putting us more susceptible than race. In this instance, but I still don't trust the vaccine. I would never take a vaccine that was developed in 6 months or a year. I don't care what the disease process was. I don't take them anyway. I don't even take the flu shot or anything like that, unless I have to have it to work at a particular facility, because I just don't trust any of this stuff.
Gotcha. Dr. V, what's your take on all this?
Yes, sir. I would like to claim systemic racism for many of the problems, particularly with the black males that are, well, particularly with black people and a lot of times poor people, because of the way the system has been put on us, that has oppressed us for so long, that right here in Houston, one of our problems, particularly in Third Ward, is that we don't even have grocery stores. We can't even go buy food to nourish our bodies. So when you systematically take away the basics for living and make people have to go to the corner store just to get some calories, which are not, they're not nutrition. It's only empty calories there. So you place us in a position where we have that sort of stuff that you know for a fact is going to depress your immune system. We know that. But rather than focusing on changing that, they generally say that it's our fault, that, you know, we're tearing up our neighborhoods, or we don't value our health. We don't seek out good health options. But when you don't have those things available, when the education that you receive doesn't allow you to process the information and say, well, oh, I really need to take care of my health like it is in other schools. When you have a better education, you can see the long term. Particularly one of the issues that I think the reason why that we have so many conspiracies is the leadership. When we go back and look at Donald Trump and his handling of this COVID thing, we can see that, you know, particularly with the news out today or a couple of days, that he knew that this was a very, very bad disease, that he knew that this was worse than the flu. He knew that it was spread by air, and rather than telling the people, here, this is what we need to stop air transmission of a disease. How do we do that? Cover our mouths up, social distance. We could have been doing that, you know, back in February when he knew about the disease. We could have started doing that at that point, and we wouldn't have 170,000 people dying from this disease. And not only will we not have those people dying, it's those people that got sick with the disease that are supposedly well, we call them well, but they still have these ongoing conditions as a result of COVID. So rather than dealing with the disease straight up, our leader has told us, oh, it's no big deal. You can take the hydroxychloroquine with a Z-Pack, and that'll just knock it right out. We've had all this information that we can't trust, which makes us try to grab other information from other sources that are even less reliable than our current president. So one of the problems, I think, is the mass misinformation that's put out, and particularly what we can pick up on the internet. And a lot of it is just conjecture, but we say, well, I don't know. we don't have any solid source that we can trust, nothing that we can hang our faith on. And really, one of the other issues is that we haven't been taught to think scientifically that, okay, here's a disease. How could this disease manifest? What are the other surrounding factors, like I'm saying about the systemic racism, like we understand that our bodies have been impacted by this systemic racism, that we don't have good health because of redlining and because of the way the grocery stores are put out there. So, you know, a lot of, again, I just want to reiterate that when you have information at the top that's not true, then you have that same sort of filtration down. So we have this misinformation from the White House that goes all the way through our system.
Dr. McReynolds, before I go to Dr. O'Dilley and Karen, because I know they want to jump on this, is President Trump right? Did this disease come from China? Did it originate in China?
When you
I
say
want to
that,
know your opinion on that.
yeah, when you say that, and that's another, that even that, the way that is stated, that it's the China virus, as if the people in China were so stupid that they would create a virus that they had no control over and would put it off on their people, their family, and we would believe that. I mean, because, you know, our president said it's the China virus. So, no, I don't believe that it was created in China. China might have been the first place that we found it, that the scientists found it. But one of the things that they talk about is that it was escaped out of the lab there in China. But when you go to the science and you start to look at the anatomy of the disease and look at the characteristics of the COVID virus as it currently exists, as those ones that they were researching in the lab, that they're totally different. That we can even see the difference in the virus when it was in England or Europe than it is here. We see it mutating. So from science, we can see that, you know, just somebody creating this disease, that's ludicrous, that did not happen.
But were you aware of the article and the news report about the Harvard scientist and his graduate students that were arrested on their way to China, which they had vials of viruses that they had, I guess, made and acquired and were trying to get out of the United States to China.
Right.
They never wanted to come out and say if that was COVID or not. But what is your take on that?
Well,
is it, what was that? What was that all about?
That's just like, you know, we try to steal any kind of secrets. And particularly, there are a lot of coronaviruses. So with that particular I don't know what coronavirus they had, but they were trying, as I understand it, to take this coronavirus and then take it to their labs. And so maybe they could get some type of cure for that particular coronavirus, not COVID-19. So, which is a different thing. People have to understand that it's like, you know, almost like the different strains. Like we have dogs, but we have, you know, we got the little small dogs, and then we have the Dobermans and the Rottweilers and the Pit Bulls. And those type of coronaviruses are what we're going to see more of. And, you know, what we have now is the Pit Bull, the first Pit Bull that's on us. But because of the way we're living and because of the way we're destroying the environment, the scientists has told us that these type of diseases are going to occur, and they're going to occur more frequently.
Dr. O'Dilley, is a lot of the stuff we're hearing madness, or what's your take? Is this a Chinese virus, or is this a virus that could have started elsewhere? And is the lifestyle, because I know y'all saw the pictures and the footage there was a movie that came out, Dr. O'Dilly. I don't want to say 10 or 15 years ago, but I remember going to the movie theater to see this movie. It was a movie by the name of Contagion, which some of y'all remember that movie, Contagion, starring Lawrence Fishburne. And
Yeah.
it basically showed that the way that the Chinese people were living had a lot to do with how the virus was spread, because they showed the bats, the bats were eating the food, the same food that the pigs were eating. And on the shows, they showed the Chinese markets where they were selling dogs and cats and rats and everything known unto man. And they were saying that because we're dealing with all of these different types of, I'm just going to call it unsanitary, because, you know, I'm not going to get into that. This isn't a religious show, so I'm not going to say that they don't have any business selling dog or cat or whatever in their open markets if that is their culture. But what is your take? Is that one of the reasons that gave sustenance to this virus, or is all of this just madness? Talk to us, doctor.
So historically, when a new virus enters the human population, it's going to cross over from an animal. So there's nothing strange about wild game meat being eaten in different parts of the world. You'll hear about Ebola virus and Hansa virus and other hemorrhagic virus in Africa that are transmitted from what they call eating bush meat. So they're eating game that you know is out and about. In Asia, you'll see and hear about other animals being eaten that we don't necessarily see as cuisine here. But eating from these animal sources spreads viruses, not unlike we had concerns about E. coli with our beef. You know, infection can come from the animals. That's not new. That's not strange. Infection can also be regional. SARS was a coronavirus from several years ago, originated in Southeast Asia. MERS, MERS, that was another coronavirus that the first cases all originated in the Middle East. So it's not uncommon to name a virus or identify a virus by where we first see the case reports. So it's nothing fancy or special about China. That's just part of the cycle of the world. What's different now is that we are a much more globally connected world. So people are flying from one continent to another on a daily basis every hour. So infections are going to spread much faster. So that's not something you can blame on the place of origination.
No.
It's something that we just have to live with and learn how to better accommodate, because going forward, viruses are going to be spreading much more rapidly. We're going to have another outbreak of Ebola on the African continent, and we're going to see cases. And the reason why we don't see a whole lot of cases spread around the world is because in Central Africa, there's not a lot of flight. So people travel the old-fashioned way. Not a lot of airports flying directly into Central Africa. They fly to the coasts. So as Africa gets more industrialized and integrated through Chinese investment, Russian investment, and American investment, down the line, we're going to see an Ebola outbreak that spreads to different parts around the world. And it's going to look not as bad as this, because it has different characteristics and properties, but people are going to definitely draw similarities.
Oh, wow. Thank you, doctor. And
I just
that's
make
real.
a statement that you have two scientists so far that said it's going to increase.
Okay. And I heard that too. I'm praying that we make it through. Karen Coney, with what you've heard Dr. McReynolds say, what you heard Dr. O'Dilly say, because Dr. V.R. McReynolds, he didn't go too deep, but he said that one of our biggest issues is systemic racism. He didn't, though, Dr. McReynolds didn't believe that it was a biological warfare disease. race. He didn't believe that, but you didn't believe that, right, Doc?
No, I didn't.
Okay. Karen Coney, do you feel the same way as Dr. McReynolds? And I know you just heard the statements from Dr. O'Dilly. What do you think is going on with this virus? Do you think that it possibly could have been something that was being worked on in a lab that got out of control for use by a government or a military? Or was this strictly just one of those things where maybe some rat droppings or some bat droppings got in some meat and one person got sick and they passed it to another person, and the next thing you know, we got a pandemic? What do you feel happened?
Well, I believe it's a combination. I believe with the systemic racism, and it's amazing that Dr. McReynolds talked about it, because that's exactly what I had written down, you know, for tonight to talk about, is that because of the lack of education, that it's intentional. I'm a tutor, okay, and it breaks my heart that these poor people have to pay me to teach their children because of the lack of education in the schools, because those children are so extremely behind, and it hurts my heart. It's systemically made like that. It is not by accident. It is not by accident that the minorities' health is where it is. It's intentionally made because there's a lack of education. They don't understand the importance of fruits, the importance of vegetables, the importance of exercising. You know, you have one generation after another who has high blood pressure, high cholesterol, this or that, you know, diabetes. It's horrible. And so I believe it's systemic, and I believe it has a combination of population control, and I believe it's set to affect our Black men. I just believe it's systemically made, because if we want to go all the way back to slavery, you know, that when these Black men were assigned to go in and get various women pregnant and take their kids away, in other words, to be used as studs, this is not by accident. And so even though it's in a much higher educational manner, it's still that they, first of all, now that they trained a Black man to be a stud, now they don't want him to be a stud, because the stud now wants to go in with their community. Okay.
Yeah.
And you have all these biracial children, and they want a pure race, some people. Okay. And so now I you know, if you go back and you know, it didn't just happen today. Like Cassandra said, they got a vaccine. Okay. If they have a vaccine, like she said, from my years of studying biology, it takes years. It takes years to get a good, honest, trustworthy vaccine. So if they claim they have one now, don't tell us that you all just decided to do this 3 months ago. That's impossible. Not from what we have studied, not from what we have studied in biology and all of our classes that we took. Now, is there something different now? Is there a new type of training now that we did not learn when we were taking biology? Okay, so I believe that and like Dr. O'Dooley say, it's going to be a constant thing. It's going to probably get worse and worse and worse, but it's going to affect the poor, you know, the uneducated. Why? Because they don't know to get their bodies healthy, to take their exercises, to drink their water, to get plenty of rest. And another thing, our Black men have to work their tails off. They don't get the rest that they need. Why do they die so much earlier than other people? Because they're working so hard. They don't get a chance to get the sleep and the rest that they need. A lot of times they're eating on the go. You know, a lot of our truck drivers, they're eating on the go, you know, and they don't get a chance to eat healthy. They don't get a chance to get out of the truck and to go exercise. By the time they get home, they're dead beat. They're tired. You know, so it's systemically made. Why? Because if you, with the education, with my children that I tutor, and they are so extremely behind. Most of my kids that I tutor are 2 and 3 years behind, you know, and these are very, very bright children. But
let me stop you. Let me stop you 1 second, Karen Coney. because I want to ask you something while you in mid shift, because I heard something that you said and it struck up something, and I'll pose it to the rest of the panel while we still got just a couple of minutes left. And this is what I want to know, because this is something that I heard. I'm a little nervous about posing the question to Dr. O'Delly, because in all the questions that we ask, 9 times out of 10, it's the medical community that's always being pictured as the bad guy. So I definitely don't want to put Dr. O'Delly in that light, but he can definitely take a stab at the question too, because we're glad to have him on the panel. I was told, and I'm talking about big pharma now. How many of y'all heard that term, big pharma? I was
Yes.
told that there are many cures, the things that we think it's not a cure, but it's more financially profitable for the community not to have the cure. There was a man that Dr. McReynolds reminds me of a lot by the name of Dr. Sebi. And Dr.
Yes.
Sebi publicly came out and said that he had cures for AIDS, for diabetes,
That's right.
even for impotence. And Dr. Sebi is not with us anymore. And if you remember 3 years ago, a conspiracy took place where a lot of the leading, what we call naturopaths, or I know everybody got their different name, naturopaths, or what we would call herbal doctors, medical doctors that practice it. Y'all forgive me, my terminology is fading me a little bit on tonight, but you know what I'm talking about. Yeah. Do you recall that they were mysteriously dying? Some of them were actually murdered.
Yes.
And it wasn't 1 or 2, but it was a big group of them over a nice slot of time. It's like they all got killed in a certain bracket. They all mysteriously were murdered, came up missing, were dead. But all of these doctors had something in common. They were fighting against big pharma, because they told us, they said there are cures to certain diseases, but the governments will not allow those cures to be released, because why could I give you a cure for cancer when I can make millions of dollars off of you, giving you chemotherapy or giving you a pill you can take every day for the rest of your life? Why would I give you a pill that will cure you completely when I can make you a patient for the rest of your life and keep me with money? Do you feel that when this virus, because once again, we're talking conspiracies, when this virus came out, is it possible that there was already a cure to this virus? While they were talking about this, was it possible, or is this something that was totally out of control? And do you think that there are some things that they don't want us to know?
Is that question for me?
Yes, it is. I'm going to let you hit it. Then it's going to go to Nurse Barnes, and then it's going to go to Dr. McReynolds and Dr. O'Delly.
Okay, well, I don't have proof. I can only go by from what I've heard. I don't know if you all are aware, we already talked about the Harvard scientists, well, they had vials, but I don't know if you all were aware that there were a lot that was the military that was there performing, I think they were having like a Special Olympics over there in China around the time when all of this stuff supposedly came out. Okay, they were saying, I don't know how true it is, that the scientist, the lady who came up missing, 2 of the people who worked in the lab there in China mysteriously have either died or either have come up missing. No one knows where they are, and then they said the American military was over there at the time, and then our American scientists, all of this stuff was happening all around the same time. So to me, that raised a red flag. Something is just not right. I don't think they meant it to get, I really honestly do not believe that they meant it to be this out of hand. I really don't, and that's just, something the way that I feel and from what I have studied, and the other scientists who, there are hundreds of scientists who literally believe that this was intentionally released. Okay, they believe that it was biological, and they believe that, but they do believe that it was not, that they have something about 5G or something like that. So you hear all these people talking, all these conspiracies, but you can't ignore them, because these are scientists who have been in the field of study for years, and you have them coming together, but they're not being listened to, and they're being shut. Their mouths are being shut. They cannot talk. They cannot say. No one is respecting what they have to say. So something, even though you can't put your finger on it, everybody on this panel knows that it's something missing here. Because all of us have a conscience. All of us know something is missing. Something is strange. We can't put our finger on it, but we know it has to do with a much higher authority than us. So yes, to your answer, yes. I believe that it's something that got out of control. We can't prove it, but it's too many scientists who do believe something is strange.
Well, I'm gonna tell you, Karen, before I take it to Cassandra, there were certain names that I made a point not to mention in this discussion, because I know that when those names are mentioned, that the broadcast mysteriously disappear from Facebook. That is a conspiracy within itself. I don't know if you've heard about that or seen that, but when you mention certain people's names that are a big part of what's going on right now, hint, vaccine research and things of the sort, when you mention their names on Facebook, your posts mysteriously disappear for some unknown reason. So that's why you really haven't heard me stick those names out there, because this is Source Seeker, this is Brother Baruti's show, so I don't want to put him in any crosshairs. But as I go to Cassandra Bourne, I want to get her take on this too, Karen, because like you said, we can't put our finger on it, but it's something that they don't want us to know. We thank God for the medical community, but it's something that's going on with the powers that be. Nurse Cassandra Barnes, are we talking out of our heads, or is there something really going on?
I do believe that there's something going on. I do believe that the female physician that was arrested, and I won't, for the reasons that you named, I won't call her name. She was very, very specific in how she detailed the evolution of this particular virus. She specifically said that it was not actually created in a lab, but it came by way of a lab. That it was manipulated in a lab. I don't believe that it is an accident that the person that owns the largest communication software company in the world got real intentional about educating Congress and everybody else about the effects of a vaccine back in 2014, 2015. The effects of a pandemic on this in this world back in 2014 and 15. He spoke before Congress. He spoke before the World Health Organization, and he is in relationship with them, a partnership with the World Health Organization. He owns much of the research that is going on related to this particular virus. I do believe that it was being developed, as that physician said, many years ago. And I do believe that they worked on a vaccine many years ago. They've been working on a vaccine. That's why they have so-called something ready to come out this quick. They've probably been working on since 2014, 2015, which would make sense. I do believe that it got out of hand. It's not an accident that physician that first broke it in Wuhan, China, when he first came out, and he said this is some virus, and that when he died, right after when the Chinese people told him not to say anything else or release anything else, next thing you know, he's in the hospital on a vent and dead within just less than a month or so.
Wow.
Because he was the one that came out initially talking about this is some kind of weird virus, and he ends up dead. So I do believe this software giant and whoever else he's in agreement with orchestrated this to be released in China, because China is known for population control. They are very heavy. I mean, you can't have but 2 children. They're very heavy into population control. So, and then when you look at it, this virus actually is less than 1% fatal, actually. So you can, what I think that they were gonna do was probably have some type of pandemic, but I don't think that they expected it to be this massive. And I definitely don't think that they expected it to hit the economy like it did. Because the reason, I'm gonna tell you the reason why you don't have HIV/AIDS kills so many people, Ebola has killed so many people, but let me tell you why it's not handled in the same way. It's because no other disease processes hit our economy like this. HIV/AIDS didn't shut the country down. First of all, he said it was a gay white male disease at first. Then it was a gay male disease. Then what happened? But for the reasons that have already been noted, now you had Black women, was the fastest growing population, because now they're sleeping with men coming out of the penitentiary. They're sleeping with men that are compromised in their behavior. So that's another show. But that's why that population of people has grown to the degree. But you still didn't see it gain this kind of popularity or this kind of fallout, because it didn't hit the economy like this is hitting the economy. This has shut when you start dealing with the money, when you start dealing with that, now you have a whole nother situation going on. That's what I don't think they anticipated. Okay? So they didn't anticipate that. So I do believe it's gotten out of hand way more than what they thought, but it's definitely orchestrated. The physician, the scientists that work with Fauci, and she named Fauci as being one of the ones that was involved in having her arrested when she started talking about this years ago. This is not something that just happened that nobody knew about. They knew about this. They knew about it. And they already probably worked on a vaccine. And now that they're ready to get this vaccine out, now the timeline of the vaccine is probably real. They're probably just now getting developed enough in a realistic sense. But it started probably back in 14 and 15 when Bill Gates and them started talking about it. When other people started talking about it. Now, that's how I feel about that.
Oh, yes, yes, yes.
Amen and amen.
Hey, what can we say? Dr. McReynolds, is there any truth to this, you feel?
Well, I'm going to go back to where I think the conspiracy first started. And, we had our president who got information from, our Secret Service or whomever we're paying to research what's going on in the world. He got the information, and rather than him providing that information out to the public, he wanted to keep us from panicking, and so he allowed the disease to spread. So, and the thing is that he did basically the same thing that the Chinese did. He just didn't kill anybody, but he killed the information that would be circulating about the virus. And, that's what we had to, deal with. When in China, they said, oh, you saying this virus is out there? Oh, we don't want to hear that. Oh, okay, goodbye. So, it's gone. And the same way that they do in the Soviet Union. We've heard a lot about, anybody that speaks anything negative about the Soviet Union. For some reason, they just come up poison, just out of the thing.
Right.
So here in the United States, we don't actually have that. We have so much misinformation that we wind up killing ourselves. So, particularly, is it a conspiracy? I think it is that when we see the health of Black folks and poor people, and then you allow the disease to progress, because we didn't have to allow the disease to progress like it did.
Dr. McReynolds, why you think they shut the Chinese embassy down? I just had to hit you with that real quick.
Well, I think that was really political, as a show to say, okay, y'all have, taken information out, you're doing stuff that's underhanded. So on the top, we don't know really what happened in that embassy, but as a show, oh, here are these Chinese people, they brought this over here, they're doing stuff now. We don't really know what went on, but on the top, we can say, let's get them out. And so it seems like we're doing something, and it feeds into more of the conspiracy. So here we are running around, we don't understand what's going on, rather than focusing on getting our immune systems up, rather than focusing on social isolating and wearing our mask and doing the things that we really need to do to stop the death and to stop the prolonged sickness that occurs with this COVID. It's not just that you get over it, that you still have conditions that last, right now we can see six months after, they're supposedly test negative for it, that they have ongoing symptoms. So to me,
all
that's
right, let me stop you there again before we go to Dr. O'Dilley. Is it the government or is it us that's killing us? And the reason I'm asking you this is, would we need to do all this social distancing if the government would just shut everything down? Because it's the government that said that the malls and the restaurants and the stores, and coming soon to a district near you, the schools, they're the ones that's saying that it can be open. So Are we really killing ourselves, or is there somebody else that's giving us the gun and the bullets to do it?
Well, I think it's from the top. Again, I go back to the top of where we invest billions of dollars to have information provided to the people, like, the National Weather Service. They tell us, hey, a hurricane is coming so that we can get out of the way. The same thing here with this virus, that we have the people that's supposed to be telling us, hey, it's a virus coming. Here are the things that you need to do to prepare. And our people haven't done that for us and left us very vulnerable. So they should have told us to social isolate, that we should have had a strategy from the top that was national, rather than, hey, Joe, what do you think you should do? Oh, Mary, well, you do something different. Everybody has their own opinion, and most of the people that are making the decision have no scientific background.
Wow. Dr. O'Dilley, you heard what everybody had to say. Are we running like chickens with our heads cut off, or what is it that we really should be doing right about now?
Well, like how we started this all, the most important thing people can do is do what they can to keep healthy in general. Exercise, drink plenty of water, take their vitamins, add some vitamin C, some zinc, some other herbs. Do that on a daily basis. Wear the mask and socially distance when you can. I like the analogy about the National Weather Service and hurricane, but even though we had early warning, this is really more like a forest fire. The people who were looking out, or supposed to be looking out for us, they saw it in the distance, and they did not tell the people in the hills that they needed to be unaware or be careful. And as we know, if you don't do anything to stop a forest fire, it is going to spread. And that's exactly what's happened with COVID-19, with serious consequences. There's been a lot said about the systemic inequalities upon which this country was built, and how Like someone was saying, in many parts of where our people live, it is difficult to obtain healthy food. That is by design. It's part of redlining. It's part of segregation. It's part of the history of this nation. And when people forget their history, they're doomed to repeat it. These are the things that we need to educate the next generations. That's part of the reason why I write, is so that they have something that's written by someone who can put it into their own words. But we do have to do more to make it clear that natural is the way to go. Processed foods, we've got to cut that down. Processed meat, food that comes in bags, high salt, high fructose corn syrup, saturated fats, etc. All of these cheap, easy, convenient food items are pro-inflammatory. Why is it that high blood pressure kills minorities more than others? Why is it that diabetes kills minorities more than others? Why is the life expectancy for minorities lower than the others? All of these things are interconnected. The same reason why COVID-19 is killing us minorities more than others. It's all the same. The system was not designed for us to do well, was not designed for us to live well. And that's the real battle we have to fight. Whether it's COVID-19, whether it's diabetes, whether it's heart disease, whether it's stroke, etc. All of these things hinge on educating our people about what we should and what we shouldn't be eating, how to exercise more, how to free ourselves from economic servitude, how to learn how to become financially independent so that we can live the lifestyles that are more conducive to us living healthy, being healthy. COVID-19 is just another chapter in the saga of how we are suffering more than the average. This is just another chapter in the same old story. So we shouldn't get distracted by China or distracted by a leader who's not a leader. We knew what he was saying back in February and March didn't make any sense. I wrote it down. Lots of people said the same thing. It's written down. So this isn't surprising. It's meant to distract us. It's meant to sell somebody else's book. We don't need to read his book. We write our own books. We tell our own stories. We spread our own knowledge. And I think that's where we need to start every day. Seeking out knowledge like this show is designed to do, and also educating everyone else. Because if the next generation doesn't make it out of here with more education than we have, then we're really not moving the community forward. So that definitely has to change. Someone was talking about educating the next generation and them being behind. As the people, we just have to value education more. That's the foundation for all success. Knowledge is more valuable than time and money because it progresses you. And I feel like in the areas of healthcare and nutrition, finances, history, and society, in terms of us moving forward, that knowledge is the key to success and power.
Wow. I know we're coming to the end of the show. I want to recognize Karen Coney because she did want to say a remark. So Karen, go right ahead.
Well, what I was trying to say is that, as I tutor my children, my students that I tutor, the system is designed to have the public schools to not be as advanced as private schools. But God has really opened doors for me. A lot of us do not know that our children qualify to go to a lot of private schools free of charge. And because of the lack of education in their neighborhoods, I'm not saying that everybody needs to go to private school, but I'm saying if your school is not where it should be, you need to push where your children can go to a higher quality school. But like Dr. O'Dooley says, it needs to start when they're young. I'm a single parent. I have 7 children, okay? And I can truly say God has been good to me because I raised my kids like an army. And it was always, I had an order that I programmed my children's brain to. God, family, education, or work. I always trained that I drilled it in their head. God, family, education, work, whichever one, and I drilled that. And I tutored my kids. When I was pregnant, I read to my kids in my stomach because I knew they could hear it. you know, and I programmed them. I got different programs. I got tutors for them. If I had to eat beans and rice, my children were going to have a top education. Where the school was lacking, I was going to be there. If I couldn't do it, I would pay anybody to help my kids, or, you know, I would try to find favor and ask God to help me. Education is the key. Like Dr. O'Dilly says, education is the key. We need to, like we're coming together now, we need to come together. We need to educate our kids, and we need to drill it to our young parents who don't have education. Hey, read to those babies. Write with them, teach them their phonics, teach them all of these children. And the sad thing about it that hurts me the most, at the majority of my children are Black young boys who are behind, because they are so smart, but they don't absorb certain things the same way. And you try to program every child learns the same way. No, every child has a success in them, but you got to find what works for each child individually, because every child is not the same. And education, you know, all I can do is just say education. It definitely is systemic racism, but we as parents, if we get off the games, get off the cell phones, off the movies, and teach our children and let them know, hey, if I got to tell you to do your homework every day, then guess what? You won't have any privileges. We've got to do it.
Wow. Karen, powerful. I ran out of time, but you can best believe, I want to say this to the audience, that we will return. This conversation is not over yet. My panelists have given us a wealth of information that we can take back and use. I want to say thank you to Nurse Cassandra Barnes. I want to say thank you to Dr. Vion McReynolds. A big thank you to Dr. O'Dilly, our medical expert. Karen Coney, God bless you. Thank you for the pearls of wisdom that you've shared with us that really are keys to life. Every last one of you have given information to the public on tonight that can take us in the next level in this challenge that we have of dealing with COVID-19. So we went beyond the time, but we will be back. You can best believe that Baruti is gonna let us know the schedule so that we can come back and give more information to the people, because right now we're still in the tunnel and we're nowhere near out of this COVID-19 mess. It is yet to be continued. So we have to keep, because it's an ongoing virus, we're gonna have to keep giving ongoing information. You know, that's what live news is all about. They give it to you as it happens. So we all will return, and I'm asking all my panelists to come back, because we truly appreciate the information that you are giving to us, that you're giving to the public, and we thank you for it. It's priceless. Until that time, we want to say as a panel to tell everybody to be safe. You got a lot of good information from Dr. O'Dilly and the panelists. Stay masked up, keep using social distancing, eat right, live right, and we're all going to make it to see another day. Well, for the Source Seeker Hour, once again, thank all of you. This is the Bishop George Sanders saying thank you and good night. Thank you to all our guests. Be safe out there, okay? God bless.
God bless.
Amen.
Bye-bye.
God bless
Your
everybody.
vote
Bye-bye.
with the census.
I was trying, Baruti.